All right, we're gonna mix insulins. So I've got my regular insulin and I've also got my NPH insulin. My order is for 22 units of regular insulin and 8 units of NPH insulin. So what I'm going to do is I'm going to get my insulin needle. I'm only going to use my orange insulin needle. I'm not going to use any other needle to drop insulin because insulin is measured in units, not in mLs. So I've got 22 and 8, so I'm going to draw back to 30 units of air. I'm going to clean both of my vials. I'm going to take my top off. I'm going to first inject 8 units of air into my NPH, which is your cloudy insulin. And I'm going to turn it to where I can see the units itself. And I'm going to go down to 22. I'm going to withdraw. I'm going to go into my regular insulin. I'm going to inject the rest of my 22. Then I'm going to flip my medication over. And I'm going to draw back to 22 units of regular insulin. Okay, now I'm going to clear before cloudy. You always want a sunshine for a cloudy day. I'm going to draw back to be very careful with the label turned towards me not to contaminate the medication, not to inject any of my regular into my NPH vial. Okay, I'm at 30 units and I'm going to remove. I'm going to safely, when I have to put my cap on, swoop and scoop my insulin. I'm going to take my syringe with me to my patient. Give me this is going to be my patient's abdomen. I'm going to make sure I clean the skin very well. I'm going to make sure that I pinch the skin. The patient is very fluffy, so I'm going to go at a 90-degree angle. If they were very thin, I'd go at a 45-degree angle. I'm going to make sure I pinch that subcutaneous tissue up. I'm going to do a dart motion. I'm going to inject my 30 units. And I also made sure to verify this with another nurse. Nurse Daly right beside me verified it with me. I'm going to inject and I'm going to hold for 5 to 10 seconds when I'm done. I'll hold for 5 to 10 seconds and I'm going to release. Always before you give insulin, make sure you know the blood sugar. I knew the patient's blood sugar was 320 before I gave the insulin. So always make sure you verify the blood sugar before you give the insulin. And we gave it in the left lower quadrant. I made sure I documented all of that.